Greetings, I'm Tammy Lee Demler. I'm your pharmacist here at the Buffalo Psychiatric Center. I am one of a number of pharmacists that take care of your medication needs while you are here with us at the Psychiatric Center. We are today talking about how to use nasal spray, and we are going to be adding to the building blocks of knowledge because we spoke of how to use eye drops not that long ago. So this is just another way of medication being delivered or being administered, and probably most of us would have already used a nasal spray or maybe thinking about using a nasal spray throughout the course of our stay here, or perhaps when you're home or at a residence and you're in need of a nose spray. So we're going to talk about what kinds there are, what types of nasal sprays are there, how do you properly use a nasal spray, what are possible side effects, and anything else I should know or expect. And I have slides and videos here in our program today, so if I forget to cover the side effects entirely, please ask your pharmacist. They'll be coming up at the end of this presentation to do an activity with you. That's the fun part. But my part is just to get you ready to answer the questions or play the bingo or whatever it is that they've planned for you today. It's always fun stuff. So let's move on. So what type of drops are there? It could be nose spray, nose drops. There's a lot of different kinds. But I have some examples here, and probably not a lot of surprise to you. And again, these may look familiar to you. There are steroidal nasal sprays. And steroidal nasal sprays, as you can imagine, if you've ever used a steroid, or even something called a non-steroidal anti-inflammatory agent, they're for inflammation. So Flonase or fluticasone is an example of a nasal spray that is steroidal. And its purpose is to reduce inflammation, to reduce swelling. We use it often for seasonal allergies. That's the most often, I would say, most often employed use. When you have allergy symptoms, everything gets itchy, you kind of get swollen, and this helps to relieve the nasal passages. Now, when I've used nasal sprays like fluticasone or Flonase, one of the things I would say, if I don't cover it later, as a side effect could be, even though it's a moisturizing feel, overusing these products can sometimes cause nosebleeds, dry nose passages. That can also be sometimes the medication you're taking for allergies, like antihistamines. That can make it worse. So just make sure that you're using the nasal spray when indicated as directed by your doctor. And over the counter, I wouldn't just use an over-the-counter medication like that without some guidance, because pharmacists can help you, your doctors can help you with using over-the-counter selections as well. Some nasal sprays have a smell to them. I know that the Flonase products that I've used in the past almost have a rose water smell. It smells like roses. Oftentimes it's not the medicine that makes that smell, it's what's in the liquid, that the vehicle that contains the medication. So if that's a little bit off-putting to you, or if you don't like that, you can ask for either maybe a different brand, or maybe after you've inhaled that nasal spray, take a sip of water, swish and swallow, and gargle it out. That can also be helpful, because a nasal spray is not something that would be required to go down into your throat. You can rinse and spit that out. Moisturizing products usually contain salt water, saline. Saline that is what they call isotonic with your tissues, so that there's no burning or stinging. It's very comfortable. We use these sometimes in infants if they've got a lot of nasal congestion and you want to clear out their nasal passages. Works just as well for adults. So if you have kind of a congested nasal passage and you want to just clear it out, putting a little water, saline water, nasal spray into your nose and then giving it a few minutes and then giving it a gentle blow can clear those passages pretty nicely. You don't want to use your own homemade saltwater solutions. I know that sometimes we are tempted to do that because they're not sterile, they're not isotonic, so they can burn. So really there are plenty of affordable formulations over the counter just to get a nice, clean, sterile product for your nose, because you don't want to introduce any bacteria or anything that will cause more harm. We also have antihistamines. Antihistamines, we talked about this, I think, before when we were doing eye drops. Antihistamines can come with nasal spray formulations also. One example is a Zelastine. That's one I've used. I've used a Zelastine with fluticasone, the combination, so you may be using more than one nasal spray at a time for different purposes. Just like we talked about with eye drops, though, you're going to want to space those out a little bit. And I'm going to demonstrate through a video how to properly clear your nose, blow your nose. You never want to blow your nose right after you put a drop in because you'll just be blowing it right out. It'll do you no good. But antihistamine sprays can be nice because if you can get relief from a topical sprayed product versus taking a medication by mouth, you can avoid some of those sedation, constipation side effects that you would get with Benadryl, for example. Decongestant sprays are very popular. An example here would be Afrin. I'm sure we could probably think of other brands that escapes me right now, but Afrin is a very popular one. Its decongestant capacity is also topical, and just like we talked about with eye drops, the way it works is it shrinks the blood vessel, not permanently, just shrinks the blood vessels temporarily so that there can be relief to the membrane, so your membranes can open up a little bit. When you have an allergy, for example, your blood vessels can swell. That's part of this whole swelling phenomenon that we get with how we would say an allergic sort of reaction. Decongestants are really nice. They work very fast and provide such good relief that many people are tempted to overuse them. So my caution here is that a side effect to decongestants could be temptation for overuse because they work so well. The problem, though, is that if you shrink your blood vessels too much, you're not going to get oxygen to the tissues. And I've had situations where I've known people to use them over and over and over for weeks and months and years, and then they're not getting enough oxygenation to their tissues, and their tissues can be harmed from that. So we need blood flow to all of our tissues. But decongestants for a day or two topically really are not a bad idea, especially if you have blood pressure issues that would prevent you from taking an oral decongestant, because oral decongestants can raise blood pressure. Nicotine replacement, also an option for nasal spray, ironically, right? We talked a little bit about smoking cessation last week. Nicotine replacement inhalers are available. As last I knew, they still required a prescription, but if you feel like you want to have an alternative product to curb withdrawal symptoms or curb those cravings, that could be an option. There's a nicotine inhaler that you can inhale by mouth, but the problem with that is it reinforces that sort of hand-to-mouth experience that you have with a cigarette. So if we're trying to really change up the routine, that doesn't really change that routine too much. So having maybe a nasal spray to get just that little bit of nicotine replacement might be a good alternative if you're really trying to change it up a little bit to help prevent, having that desire to smoke. There's also opioid reversals. I'm sure you've heard of naloxone. There's now a new one, nalmefene, I would say nalmefene, maybe is how we say it. We don't have it in stock here yet, but it is an alternative, and actually we'll talk about that as we go through a med guide to talk about just a way of using medication information to guide how you use medications. And maybe if you would tell your pharmacist in the group activity today whether or not you might want a naloxone, kind of a 101, an introduction on how to use it, it's always a good idea to have it in your possession if you're at your home or in a residence where people might be subject to or exposed to opioids and at risk of overdose. So let your pharmacist know, and I can build something. I can develop a topic on that if you're interested. And then we have also options available for mental health. These require very specialized care settings. They're not available everywhere, but we have some inhaled medications for very refractory depression and also for cluster seizures. So it's kind of interesting. It looks like we're moving in the direction of nasal inhalation being a more common, more popular pathway. And and there's also a nasal spray, interestingly enough, to reverse episodes of low blood glucose in people who have diabetes. So there's a thing called glucagon that we have as an injectable medication, but injections require, a lot of very careful maneuvering. So you have a needle, you've got somebody who might be thrashing about because of the experience that they're having. Here, this is a nasal spray, and that requires very little prep, very little pain because you're not getting a needle stick, and this can be a really nice thing. So we actually changed over to nose spray for reversing episodes of low blood glucose here at BPC. So I just share that because it's interesting, and again, to my point that it's more popular. So here's a video, let's watch it together. This is how to do a nasal spray.
Hi, I'm Dr. Paul Paddle, ear, nose and throat surgeon at the Melbourne ENT Group. In this video, I'm going to talk about a common ENT treatment, the use of nasal sprays. I'll briefly describe the types of sprays, some of the reasons and benefits of their use, how to effectively use nasal sprays, and additional useful tips, risks and benefits. Nasal sprays are solutions or suspensions of a medicine that are sprayed into the nostril to produce a direct effect inside the nose. Some common medications in nasal sprays include balanced salt water, steroids, antihistamines, decongestants, moisturizers, leukotriene modifiers, and a number more. Some nasal sprays are used to administer medicine that acts on other parts of the body. In these cases, the medicine is absorbed into the bloodstream from the lining of the nose, which is rich in blood vessels. Today, we will focus on sprays that are designed to have a direct effect on the sinonasal passages. Blow your nose so that your nostrils are clear prior to use. Wash your hands, shake the bottle, take the lid off the bottle, tilt your head slightly forward. Close one nostril by gently pressing against the side of your nose with a finger. Using the opposite hand to the side of the nose you are treating, insert the tip of the bottle into the nostril and start to breathe slowly through your nose. While you are still breathing in, squirt one spray into the nostril, keeping the bottle upright. Remove the bottle from the nostril and breathe out through the mouth. Tilt your head backwards and allow the spray to drain to the back of the nose. Repeat this on the other side of the nose and repeat again on each side if more than one spray has been prescribed. Replace the lid on the bottle. Ensure that you prime the inhaler spray device before using it for the first time, or if you haven't used it in a while. Use it as directed and do not skip doses. Ensure that you hold your head in the correct position, tilted forward, not back. Don't push the nozzle too hard or too far into your nose. Don't blow your nose after spraying, as the medicine may be lost. Don't sniff hard after spraying, as the medicine can end up in your throat instead of your nose. Saline sprays or irrigations are best used 30 to 60 minutes before using a nasal spray. Some nasal sprays give an unpleasant taste as they drain into the back of the throat. A drink of water or other liquid can help to take this taste away, and it's not dangerous. Sometimes a nasal spray may cause some blood-stained mucus or even a minor blood nose. More often than not, this is just due to a minor scratch of the spray nozzle against the lining of the nose. Whilst in theory, certain sprays can cause a minor thinning of the nasal lining, this is a very uncommon cause of blood noses post-nasal spray use. It is almost never serious and generally settles spontaneously or with simple first aid. Do not share nasal sprays with other people, as that may transmit infection. Do not use nasal decongestant sprays such as Otrivin, Drixine, Sudafed nasal for more than 1 week, as this can permanently damage the lining of the nose and make nasal congestion worse. Always use the nasal spray according to the printed label or as directed by your health practitioner. Never use the nasal spray after the expiry date, as it may be contaminated with dirt or bacteria. If you miss a dose of nasal spray, take the dose as soon as you can and remember, and then go on as before. Nasal sprays are intended to be used in the nose and must not be taken by mouth. As always, we encourage you to discuss any questions or concerns with your GP or ENT surgeon. Thanks for watching. For more videos on ENT conditions, treatments and procedures, check out the rest of the videos on this channel, or head over to our website for more details and downloadable information sheets.
Perfect. So we're back here now. I liked that the doctor mentioned about not sharing your nasal spray. I would have remember that we talked about that with eye drops. Same thing with nasal sprays. Even if you wipe them off, sharing can transmit bacteria because a little bit probably gets into that little nasal clip. You can't be bacteria free when you're sharing with somebody. Kind of having your own bacteria and your own colonization in your nose is what your body would be used to, but not somebody else's. The other thing that he mentioned that I thought was a great point is that with the decongestant sprays, I mentioned that overusing them can cause you to be tempted to continue to overuse. It not only causes you not to have oxygenation because it shrinks the blood vessels, but when you stop using them after you've used them too long, you get worse congestion. It's called rebound, and it it's worse than you started. So again, be mindful not to overuse. And here's a funny little clip. I like these little gifs. To blow your nose gently, not super hard, because again, you don't want to, there's no reason to blow your nose hard. If you feel congested, you could use a little saline moisturizer to kind of loosen up the congestion and then blow. But here we have Betty White from the Golden Girls blowing her nose gently. So just as an illustration to just remember. Washing your hands, remember the time to wash your hands to a period that would be consistent with having no bacteria left on your hands would be to a happy birthday song, about 20 seconds. It's a long time, so singing happy birthday slowly is a good way of being able to be able to monitor that time. If instructed, you're going to want to gently shake that bottle for 10 seconds. Shaking sometimes isn't indicated with every medicine. Most of the time you can't do harm shaking, but ask before you shake. You just want to make sure. Suspensions require shaking. Suspensions are those such that the particles need to be evenly distributed, and if you just leave it to settle on the bottom, you won't get your full dose. But solutions don't require shaking. But some medication now, newer medications that are more high-tech, maybe, as you would describe, monoclonal antibodies and the like, sometimes you can disrupt the medicine if you shake it. But again, not a lot of nasal sprays that I can think of that would be harmed if shaken, but just ask your pharmacist before you assume. We generally put a shake well on the bottle so that you would know. Removing the cap, you saw the doctor remove the cap before he put in the medication. When you have the cap, I would suggest maybe not having it in your hand because that's complicated, but put it down on a clean tissue so it doesn't get contaminated on the surface of a counter. And use care to make sure that the cap is clean and free of contamination when you return it to the bottle. Prime or reprime only if instructed to do so. I'm going to give an example of a medication that should not be primed. It's ready to go right as the first dose, and there's only a single dose in there. So just ask again, should I prime this or reprime it when I'm using it? Most often, if it's sitting without use over a period of time, repriming would be necessary. And if you are priming it, that means to spray it into the air, not in your face. Keep it kind of away from your face entirely, because you could end up getting it in your eyes, and that can burn. Nasal sprays aren't intended for the eyes, so they may burn your eyes if you get any in there by mistake. And it's happened where maybe you miss your nostril and you end up getting some in your eye. Just rinse your eye out with some saline eye drops if you run into trouble there. Here, how do you properly use? I'm going to show you a little video in a bit about this cartoon character, how she is going to be using it, but I wanted to just make sure that you read the instructions so that you can see it and maybe be more apt to understand the process. So you need to get in position, and that's with your head upright and tilted slightly forward like the doctor did. And you're going to press your finger against one side of your nose and close one nostril. Now what I saw him do was he crossed his arms. I think that's awkward, so maybe just use the same side, block your nose, do your spray, and then you're going to repeat if two doses are, if each nostril requires a dose. It's not always the case. Here you're going to then position the spray. You've already taken the cap off. You've already put it in a clean, dry place. Then you're going to insert the nasal spray into the nostril that you're not blocking. So block the opposite nostril, put the spray into the single nostril, that's the intended nostril, and then squirt that spray. Sometimes you're not going to hear it be a real big squirt. It can be a very small mist, so don't keep spraying if you don't feel like you hear it. You're going to want to make sure that your thumb is supporting the bottom of the bottle so that you have some leverage. And then you're going to press down on the white applicator with 2 fingers. Every nasal spray looks a little different, but for the most part, they're generally the same and universal relative to the equipment that they come with. You're going to want to breathe to inhale the spray. And again, not so deeply that you're bypassing the nose, just a nice gentle breath to kind of encourage that spray to move backwards into the nasal passage. And if you get some into the mouth, you're going to want to just rinse out and spit. It's not dangerous, but it may taste bad. So out through the mouth, in through the nose gently, and out through the mouth, because you don't want to blow out through the nose, or you may have the nasal spray be blown out of the nose. You'll want to make sure you confirm the directions and use as directed so you get the dose you've been prescribed, because some sprays are used in both nostrils. So it'll say 1 spray in each nostril once a day. But sometimes it might say 2 sprays in each nostril twice a day, or whatever the instructions are. If that's the case, you're going to alternate 1 spray, and then back 1 spray, 1 spray. So make sure you're really finding out from your pharmacist or doctor how many sprays you're supposed to be doing. It can be very confusing, and sometimes the instructions may not be as clear as we would think when we leave the doctor's office. When you're at the doctor's office or you're being prescribed a medicine, there's a lot of things that you're thinking about, and oftentimes the instructions that we hear may not be the instructions that we're actually given. So make sure that you repeat back the instructions that you're told. You're going to want to make sure also, let's see what we got going on here. Stuff. Okay, so once you're done with that, you're going to put the cap back on, and not to contaminate. Remember we talked about that. Use care not to contaminate your drops. And then blowing your nose after your dose is instilled will waste the dose. You can dab a little liquid if it comes out. So invariably, you'll see some of the liquid out front of the nose. Just dab it. You don't need to blow it, and then just wait at least 10 minutes before you lightly blow, if at all. If you can avoid blowing the nose for even a half hour, that would be great, but 10 minutes at least. And certainly, if you sneeze or such, I would not reinstill the dose. I would assume that you've gotten the dose and then just be on your regular schedule.
How to use nasal sprays properly. Blow your nose gently before using the spray. Wash your hands well with soap and water. If instructed by your pharmacist or doctor, gently shake the bottle for 10 seconds. Remove the cap from the nasal spray container. Some nasal sprays need to be primed before using for the first time, or if they haven't been used for several days. Check with your doctor or pharmacist first, and if your spray needs to be primed, spray it into the air, away from your face, a few times before using. With your head upright and tilted forward slightly, press your finger against one side of your nose to close one nostril. Gently insert the nasal spray into the other nostril. With your thumb supporting the bottom of the bottle, press down on the white applicator with 2 fingers. Breathe in through your nose and out through your mouth. If you are using spray in both nostrils, repeat steps 6 and 7 for the other nostril. If you are using more than one spray at a time, repeat steps 6 and 7. Put the cap back on the nasal spray container. Avoid blowing your nose for several minutes after using spray. Always follow the directions provided by your doctor or pharmacist. These instructions are meant to be a general guideline. Check with your pharmacist if you have any questions.
Okay, so hopefully that was a good way of being able to solidify all the points that we made when we started talking today about nasal sprays. So this is something, anything else I should know or expect? This is the OPV, that nasal spray for opioid reversal if you have overdose or know somebody who's having an overdose. Naloxone was initially the one that we saw all the time. This is another option, but this is really more an instructional depiction of how you read information given to you. So this is a med guide. Most medications, not all, but most medications that have maybe some degree of risk or need special instructions come with a medication guide. I love these because they're very, very patient friendly. My family and friends can read them very easily, and they don't need my interpretation as the pharmacist that they know to help them understand it. So what you're seeing here is that, and I'll read it to you, you and your family members or caregivers should read this information before an opioid emergency happens. Information does not take the place of talking to your healthcare provider or your medical condition or your treatment, and certainly using a nasal spray like this opioid reversal, it doesn't take the place of an emergency call to 911. But this talks about what you should know about the nasal spray, and I'm not going to read these to you specifically because this is not a conversation about this specific nasal spray entirely, but what I wanted to show you is what the med guide looks like, and it talks about what it is, what and when to not use it, and then more importantly for us today, I want to show you here, before you use the spray, what you should tell your doctor, and how should I use the nasal spray. If you see this little part here, I'm going to give you an arrow. So this says each OPV nasal spray only contains 1 dose of medicine and cannot be reused. So do you think it needs to be primed? No, because if you prime it, you're going to lose the total dose. So that's an important thing. Do not test or prime OPVEE before use. So you're going to want to ask your doctor or pharmacist, does this nasal spray need to be primed? It may not have as many doses in it as necessary if primed and not supposed to be primed. And then here it says it should be only used in one nostril. So again, how many doses, how many nostrils, how do you do that division of doses? And it says if you need additional doses, you need to get you have to have another additional OPVEE spray. So OPVEE spray should only be given in one nasal passage, and again, additional doses if needed. You have to be able to have additional supplies. So this is again just an illustration of information that you can't assume. And then we talked about that already. So this is just more side effects with OPVEE. Again, we might do a show on that entirely, that program, to be able to help you with it. So let's do some wrap up and review. And I'm going to just say that I've got some questions and Q&A, and then I've got a few little things I want to talk about if we have a little bit of time left. So, ready? What kind of nose sprays are available? We have options for allergies, for opioid overdose, to correct low blood sugar, or all of the above. Which of those do you like? I choose all of the above. I bet you did too. Good job. Let's go on to the next one. How do I properly use nasal drops? These are your options. Blow the nose hard before use. Blow your nose gently after use. Dab your nose only if liquid leaks out, or all of the above. Which of those are most tempting? Usually it's all of the above when I have all of the above, but nope, not this time. Dab the nose only if liquid leaks out. You can't blow your nose hard. If you blow your nose hard, you're going to end up disrupting the membranes. You can end up with a bloody nose, and it's not necessary. If you have congestion before you put the nose spray in, what did I suggest? Saline, nasal saline spray, soften up the tissues, gently blow. It helps an awful lot. And blowing your nose gently after use, option B, not a good choice because you're blowing the medicine out. So it's not going to do any good for you to be able to have that medication in the nasal passage. Another question, how do I properly use? More options here. Always shake the bottle before you use it. Only shake the bottle if instructed before use. Always remove the cap before shaking, or never shake nasal sprays. Those are a little bit more challenging, right? So I'll let you have another thought. I'll read them again. Always shake the bottle. Only shake if instructed. Always remove the cap before shaking, or never shake nasal sprays. Okay, which do you like? Only shake if instructed. Remember I said that some of the sprays shouldn't be shaken. Usually it's not a problem if you shake anyways, but some medications nowadays may be disrupted if you shake, so you need to make sure you check. Always shaking the bottle before use isn't because of that the correct answer. And then C, always remove the cap before shaking is a trick. So you always remove the cap before instilling or administering, but if you shake without the cap, you could end up having some of the medicine spill out. And then never shaking nasal sprays is never right, because never is never, it's never always, right? So sometimes we do need to shake nasal sprays, so that one is not correct. And then we've got all sprays should be used within both nostrils. Only spray in both nostrils if instructed to. When spraying, plug the opposite nasal passage. Or D, plug nose and inhale spray through the mouth. I'll read those again because that's a little bit of a challenge. All sprays should be used in both nostrils. Only spray in both nostrils if instructed to do so. When spraying, plug opposite passage. Or plug nose and inhale spray through the mouth. I think I might have actually gotten two of these correct, because C is right, when spraying, plug the opposite nasal passage, but only spray in both nostrils if instructed to do so is also correct. So if you picked B, I will give you that one. I think I was trying to be fancy with my choice there, but B and C are both correct. But plugging the nose while you inhale through the mouth is not correct. And all sprays should be used in both nostrils is not correct because, as I showed you before, the one spray we just saw was only one nostril. And I want to thank you for joining our program today. I think at that point we're going to just probably end here because I know that your pharmacist is on their way to do your group activity. But I will just say a few quick things really quick. Always ask your doctor or pharmacist when you're getting any kind of nasal spray or any medication, what is this medication for? That's a good question. How long should I take it? What is the duration of time so that you know? Could it be 10 days or is it going to be forever? Because some medications might be forever. What should I expect when I take this medicine? What are some side effects that I can expect? You know, it can be a wide array of different side effects. And it depends on how long you're taking a medicine, right? So if you're taking a medicine for just a few days, the side effects may be a little bit more short-lived versus something long-term. Are there any special instructions to use or I need to use when taking this medication? With medicines that are for by mouth, with food, without food, those things matter. But with the nasal spray, you may want to say, if you're using 2 nasal sprays, which one should I use first? And how long should I wait between the inhalations? Maybe if you're taking 2 sprays each day and they're once a day, you could take one in the morning, one in the evening. That's a possibility, right? And is there anything I should avoid when taking this medication? Good point, right? What is something I should not do when I'm doing this medicine? And then another thing we haven't talked about is what do I do with medication once I no longer am using it? How do I dispose of it? And that's a good topic for another day. I think maybe we could talk about how to safely dispose of medications. And with that, have a great day. Thanks for tuning in. We'll see you next time, and we'll see your pharmacist in just a few minutes. Bye-bye.